you like many of our patients that are suffering from chronic pain due to degenerative disc disease or arthritis? Degenerative disc disease and arthritis are primary causes of chronic low back pain. And here at Square One, we have very specific treatments that help address the underlying cause of these conditions to help our patients achieve fantastic results. So if you like this information, you think this information is helpful, be sure to comment below and give us a thumbs up. Now, there are several things that actually can cause your disc to degenerate and arthritis in your low spine. Some of the more common causes of disc degeneration and arthritis are: 1, a loss of the normal curve in your lumbar spine. You see, when you lose the curve in your lumbar spine, that transfers all of the weight to those discs in the front and will actually cause the disc to break down and decay. If you have too much curve in your spine, that actually puts the weight on the back of the joints called your facet joints and will cause arthritis to build up in your facet joints. Another cause of degeneration and arthritis is excessive motion from unstable joints. Typically, this comes after some kind of trauma like a car crash, where the ligaments that hold your spine together get stretched or damaged, and then your joints move too much. This will cause your disc to break down and ultimately to arthritis and eventually to chronic pain. And then also, we do get some natural degeneration throughout life as we age, but we don't have the same amount of degeneration in the whole body. It's areas that have excessive stress and strain that tend to get more or accelerated degeneration and arthritis. So we always have to look at why some areas are breaking down faster than other areas, and we have to fix the underlying cause of those areas breaking down and decaying. Now, as your spine starts to degenerate and you get arthritis, there's 3 reasons that causes more pain. 1, when you get degeneration in your disc, you actually grow more nerve endings on the outside of the disc. The specific nerve endings that actually sense pain, these are called nociceptors. Now, the more pain receptors you have, the more likely your body is to send pain signals. So an increase of pain receptors leads to an increased back pain with disc degeneration. 2, as your discs degenerate and you get bone spurs or arthritis building up, you close off the opening where the nerves come out. So you're more likely for those nerves to get impinged or irritated, causing extra pain. And the last one is, as you decrease your disc height, that weight gets transferred to the back of the spine in what's called your facet joints. And when your facet joints got extra stress and strain, it causes arthritis and inflammation in your joints. And facet joint irritation is a major cause or major driver of chronic back pain. Now, here at Square One Health, the first thing that we do is we find out what's actually causing your disc to degenerate, what's causing your arthritis. And then we'll use our very specific treatments to address the actual cause of your back pain. For example, if your discs are decreasing in height, we will use something called spinal decompression. Spinal decompression actually increases the spacing between the joints in your lower spine. It pulls on your spine, sucking and absorbing fluid back into your disc, helping recover some of that height of your disc and taking excessive pressure off arthritic joints. This takes pressure off of nerves and off the joints. It helps with back spasms, but it's great for low back pain relief for someone that has severe degeneration and arthritis in their lumbar spine. If you have a loss of curve in your spine, we will use chiropractic biophysics mirror image traction to reshape and remold your spine back into its normal position. If you have specific joints that are locked up and stuck, we can use specific chiropractic adjustments to get those joints to move freely, decreasing pain and irritation. We can use very specific physical therapy, stretches and exercises to increase mobility and also to strengthen and stabilize the spine as well. And we also can prescribe specific at-home traction that patients can do in between their visits that can help reshape the spine at home. Now, another thing we give our patients that are dealing with chronic pain from disc degeneration and arthritis is a back brace. And these back braces are great because they actually take pressure off the disc and off the joints, causing great relief. These are great during acute phases of care when patients are in a lot of pain because it actually takes pressure off the joints and helps the patient heal and recover. We just don't want to wear these all the time because if this type of brace is worn all the time, that could lead to some weakening of the abdominals and back muscles that support and provide strength and stability. So these are the different things that we can provide at our office, Square One Health, to help treat the various causes of disc degeneration and arthritis. The key is not just doing random treatments. You have to find out what's driving the underlying cause of the problem and give a very specific treatment to fix the very specific cause. Now, if you're liking this information, be sure to subscribe to our page so you get updates when we have more videos like this. And like I said, if you have questions or things you want to learn about or us to talk about, be sure and put your comments below. I'm Dr. Chris Gubbles from Square One Health. Hope you found this helpful, and let us know if there's someone you know that you think would benefit from our help.